Hi everyone, this is Tori Vandelin with Prevent Connect. We have passed the 6-month mark of the start of the COVID-19 coronavirus pandemic. And in that time, since March of 2020, here at Prevent Connect, we have been having lots of conversations with multiple folks across the country and in different positions about, what do we do right now? The context in which violence occurs and the context in which we can prevent it has completely shifted due to social distancing and stay-at-home orders, economic stress, not to mention all of the other social and civil stresses that have been happening lately. So we wanted to use our podcast this month as an opportunity to take a look back at the quotes and conversations that we've had with other people around what does it mean to prevent sexual and intimate partner violence during a global pandemic? What does it mean to be a preventionist in super unprecedented times? And I know for folks listening, this may be the 30th time you've heard the word unprecedented today, but it rings true. We don't have a blueprint for this. So how are folks being creative? How are folks connecting with their communities? And what can we do to prevent sexual and intimate partner violence in this new context and mitigate against some of those risks that are increasing for people experiencing sexual and intimate partner violence? So this podcast will come to you in 2 parts. And on this first part, we are going to dive into the ways that people have conceptualized how our context has changed and some ideas that they have that connect back to those root causes of sexual and intimate partner violence, the shared risk and protective factors among multiple forms of violence, including sexual and intimate partner violence, and where do we go? What can we lean on and what can we expand on for creating prevention in these times or amplifying prevention in these times? So to start off, we want to take a look back at Prevent Connect's David Lee's story of the 1989 earthquake and how that impacted the prevention work he was able to do.
So in 1989, I was working in San Francisco, California, doing sexual violence prevention work in the schools and had a wonderful job doing work, actually working everywhere from preschools to training peer educators in high schools to be able to do a wide variety of work. And in the fall in October, we experienced the Loma Prieta earthquake, and you see a picture here. And as a preventionist, when I could finally get back in to go in to the schools, it became the question of what would I do as a sexual violence prevention practitioner. And as I started going into classrooms, I saw there was so much trauma. I saw that there was so much shock that people are in, and that the issues that we had to talk about were not going to be about what was sexual violence, even the strategies that you would take to prevent it, but it was talking about people's experiences.
When we're talking about what's happening with COVID-19 and the coronavirus pandemic, it's not just the impacts of trauma and shock on prevention that we're looking at. We also are recognizing some major gaps in our systems. These gaps were present before coronavirus, but these gaps have become a little bit more clear and a little bit more maybe everyday conversation for folks that maybe weren't thinking at a systems level before. So I want to share this quote from Prevention Institute that had me thinking at the beginning of the pandemic and all of the associated stay-at-home orders. And it still has me thinking a lot now about this is the way in which that we are all connected, the way in which that coronavirus is connected to violence prevention. So to quote the Prevention Institute's strategic framework, everyone's health, safety, and well-being are dependent on the health, safety, and well-being of others. When we protect those who are most vulnerable, we protect our society as a whole. So I appreciate the concentration that this quote has on protecting those who are most vulnerable. That's been a conversation ever since March, February, earlier in the coronavirus pandemic. So we want to bring up a clip now from our colleagues at Prevention Institute on our web conference, Preventing Violence in Our Homes, Meeting This Moment with Care, Connection, and Justice. So Lisa and Alicia talk a little bit more here about these system and root cause overlaps that we're seeing a lot between the coronavirus pandemic and sexual and intimate partner violence prevention.
I wanted to share this graphic and paper from the Center for Global Development. It unpacks pathways between the pandemic and violence against women and children. So we're seeing here on the graphic things like economic insecurity or social isolation are just a couple of the pathways that are discussed here. And so one example is how close quarters, especially those that are tied to stressful situations, are linked to stress, fear, and poor mental health, which can in turn increase the likelihood for violence against women and children. You can definitely read the full paper if you want more details to learn more about this, but just wanted to illustrate a little bit about how the impacts of the current climate can relate to violence in the home. I'm going to turn it over to Lisa, who's going to share a bit about masculinities and racial justice.
Yeah, so we found this article in the conversation helpful for highlighting how social and structural and political factors are shaped by gender norms to influence much of what we're seeing right now, including everything from underlying health conditions, hygiene practices, degrees of and ways of being socially connected, the kinds of political solutions that are being advanced, and more. And we know that gender norms. We know that use of power and how we find a sense of control and power in our lives is shaped by gender, and that potential abuses of power and control over others is shaped by gender norms, among many other factors. So we wanted to, highlight that. We also know that racial injustice is also shaping what's happening in our communities, is always shaping what's happening in our communities. Structural racism and other forms of structural oppression have created inequitable community conditions and are root causes of public health and safety problems. We know that Black, Brown, and Indigenous communities are being hit hard by the virus, as well as other conditions that can increase the risk for violence. And so we're really holding racial justice policies and solutions and centering those, as well as gender justice and other forms of social justice. On the next slide, we also wanted to highlight that there is an evidence base for what works to prevent various forms of violence in the home. And these are just a few from CDC's tech packages that might be helpful to think about with adapting to the specifics of what we're facing right now.
So not only is it important to keep in mind these intersecting, overlapping needs and where system gaps are a little bit more prevalent for certain groups than others, but there's also this call that we heard from our web conference guests, and I think even now, 6 months into this, as folks are adjusting, still holds true that there's a need to take this great shakeup of a moment and use it to recenter ourselves on the humanity within prevention. So we'll listen to our guests here.
It's about trying to prepare people who are seeing systems for the first time in action, to be able to recenter in a totally people-focused, wellness-focused way, and not try to go back to normal, because normal wasn't working for so many of us. And try to use this as an opportunity to do better for everyone.
And are you seeing some sort of openness or recognition of that what's happening is really sort of human-centered response?
I have seen very little pushback on the idea that we need to kind of stop the business as usual piece. And I mean, people have just been kind of refocusing their efforts and chipping in everywhere they can. I know Hillary is swamped with volunteers who want to help.
I think the realization that a lot of folks are coming to and have been coming to for a while, but I feel like it's really palpable right now, is that we cannot disconnect prevention from community connectedness, social cohesion, connection with each other. We say that sexual and intimate partner violence doesn't happen in a vacuum, and neither does prevention. And this concept of community care, community connectedness, social cohesion is so important now more than ever. And to wrap up this podcast, we will end with where we started and listen in again to David Lee's takeaways from working on prevention during the 1989 earthquake.
I think we all know intuitively, and that now our science is showing us, that social cohesion is an important protective factor. Social connectedness is an important protective factor towards things such as sexual violence and other issues, domestic violence. And that this conversation that we had was really helpful. It also forged relationships, that we were there to meet the needs that were existing in the community. And the community was not wanting to talk about sexual violence at that time, but they wanted to talk about how we would come together, and we were able to be support for that. And I felt we were able to strengthen our sexual violence prevention message and work together to be able to move forward. And so today, when I look at what's going on, obviously an earthquake is very different than the pandemic we're experiencing. The scale is much broader, the number of people, the length of time. But I think our response as prevention educators is so important.
Thank you all for listening to part 1 of this podcast, where we just really wanted to take a moment and reflect on how our context has changed and how it's stayed the same and stayed consistent in the last 6 months. So the next part of our podcast, we will talk more about what does this context mean for prevention? How are people preventing sexual and intimate partner violence during this ongoing pandemic? Thanks for listening. Be sure to check out the podcast post on our website. It will have links to all of the materials that we pulled quotes for this podcast.